When it comes to fertility medicine, there are so many different medications that are name dropped, and Lupron is one of them. So I wanted to take a moment to explain what Lupron is, how it works, and the variety of ways that we use it in my field. Okay, so first off, Lupron acts like a hormone that exists in our hypothalamus, which is an area in our brain that controls the pituitary gland, which is like the master gland that controls most of the major hormones in our body. So basically what it is a signal being sent from the gland that controls the pituitary called the hypothalamus, and it tells the pituitary to make FSH and LH, follicle stimulating hormone and luteinizing hormone. And these are signals that go directly to the ovaries and cause the selection of a dominant follicle, the maturation of the egg inside that follicle, and the eventual ovulation of that egg. Now, what's interesting about this part of the pituitary gland that produces FSH and LH is that if it's exposed to GnRH agonist, which is like Lupron, for a prolonged period of time, it actually starts to have an opposite effect on the pituitary, where it prevents the release of FSH and LH. And this is where most of the confusion comes from when people hear about Lupron being used in different ways. So let's talk about some common ways that Lupron is used, practically speaking, in my field. So the most common use for it nowadays is that it is usually used as part of the trigger shot, the final step in maturing the eggs right before the egg retrieval. Oftentimes we're using protocols now where we give something called a dual trigger. So instead of just giving 10,000 units, the highest possible dose of HCG as the trigger shot to mature the eggs, oftentimes we're using a fraction of that dose now. We're using like 1/10 of that dose, sometimes zero HCG at all. And we're able to supplement the trigger shot with Lupron. And by giving Lupron 40 units or 80 units and maybe a little bit of HCG or no HCG, it can work in the same way, but it's a different mechanism. So by giving yourself that Lupron, it's replacing that hormone signal that would normally get sent to the pituitary, and it forces your pituitary to release FSH and LH. That LH is just like the LH signal that you release mid-cycle to mature and ovulate an egg. So by giving this as part of the trigger shot, it can allow you to mature the eggs that have been growing during the course of the stimulation. And the nice thing about it compared to HCG is that LH, when you're releasing it endogenously, has a very short half-life. And so it has a much lower risk of hyperstimulation. So just to be very clear, the ability to mature the eggs with Lupron causing your pituitary gland to release LH has allowed us to use lower doses of HCG or no HCG at all. And HCG, which has a really long half-life, would normally continue to stimulate the ovaries. And that's been a huge culprit in years past when it comes to hyperstimulation syndrome. So by being able to eliminate using it at all or really minimizing the amount that's used, it has greatly reduced the risk associated with egg retrieval when it comes to hyperstimulation syndrome. We also commonly use Lupron in certain IVF protocols. The most common one where we see it being used today with modern day IVF is in a protocol called microflare or microdose Lupron, where you're basically throughout the stimulation cycle giving very small doses of Lupron, usually morning and night. And at the beginning of the stimulation on day 3 or day 4 of the cycle, it actually has that stimulatory effect on the pituitary gland where it makes it release more FSH and LH. So you're almost stimulating the ovaries internally as well as giving externally more FSH and LH. So it's kind of like a double stimulation of the ovaries, and this is why this protocol is typically reserved for low responders. It's a more aggressive protocol, and you can't use Lupron for the trigger, you have to use HCG. Now, what's interesting about the microdose Lupron protocol is that while it is causing this burst of activity from the pituitary and causing this internal stimulation on top of the external stimulation of taking additional FSH and LH, after a few days of taking the microdoses of Lupron morning and night, it's actually going to start to blunt your pituitary's response and actually start to prevent the release of FSH and LH. So it almost has like a dual role, where at the beginning it helps to stimulate the ovaries, but then near the middle and tail end of the cycle, it's actually what's helping you to prevent ovulation before the egg retrieval. Another way that Lupron has been used as part of an IVF protocol is in something we call downregulation. So the earliest protocol for IVF, before we had all of these other options, was called the long protocol or the downregulation protocol. And this involved taking a daily injection of Lupron starting in the preceding cycle, a week after you ovulated, and you just take it every single day, and then you start your shots once you get your period about a week into the Lupron injections, and you start taking the FSH and the LH to stimulate the ovaries, and you just continue with the Lupron up until the HCG trigger shot. And its basic reason that you're taking it is to prevent ovulation. We can also use Lupron as part of an embryo transfer protocol, and there are really two major ways that it's used now. One is as part of a down regulation protocol, so similar to what we just talked about for an egg retrieval cycle, but instead, when you're preparing for an embryo transfer, it involves taking the Lupron, starting with daily dosing a week after you ovulate in the preceding cycle. You continue it on and then eventually get a period and shed your lining, and you continue the Lupron, but then start taking estrogen to stimulate the lining of the uterus. And once the lining looks thick enough to schedule the transfer, we would stop the Lupron and add in progesterone. This is something that I will often use in patients who were on a medicated prep cycle for frozen transfer, and they somehow broke through and ovulated despite being on, estrogen pills 3 times a day. This is a really effective way to control the ovaries and to prevent ovulation, and it's often sometimes a go-to from day one for patients who have diminished ovarian reserve, especially patients who are much older, because they're at highest risk of breaking through the estrase and ovulating early and having to cancel the cycle and start prepping again. Sometimes Lupron is given for a period of 1 to 3 months, depending on the doctor, depending on the protocol, prior to a transfer in an effort to suppress endometriosis prior to transfer and improve the overall outcome. Now, this isn't a standard protocol across the board. It's not based on the most robust data. There aren't any randomized controlled trials that have looked at this properly, but we know that Lupron is a very potent way to suppress the process that feeds endometriosis, and so it can be, a last line of medical treatment management-wise when it comes to endometriosis. So the idea is to use it to treat endometriosis and to be as aggressive as possible when it comes to medical management of endometriosis in the lead up to a transfer to try to optimize the environment. And like I said, there aren't major standardized protocols, but in general, a lot of people are going to go for at least 1 to 3 months of Lupron prior to doing the actual transfer. Side effects wise, what you need to know about Lupron is that it is very potent when it comes to suppression of the pituitary, and so it can lead to very, very low levels of estrogen. This is temporary. This is why sometimes people will refer to it as inducing a temporary menopause. It is very normal for it to cause hot flashes, vaginal dryness, and if taken for a really prolonged period, I'm talking years, this can definitely thin the bones and predispose to osteoporosis. So this is why it's not a viable long-term solution when it comes to the medical management of endometriosis, but it can help in the short term to suppress endometriosis effectively. Now that you know how Lupron works and why we use it in different ways with different protocols, whether it be for egg retrieval or embryo transfer, hopefully that clears up a lot of confusion. But let me know in the comments if you have any other questions about Lupron.